Welcome back. For the last chapter of the amoebas, we will cover the two tissue amoebas, Naegleria fowleri and Acanthamoeba species. Starting with Naegleria fowleri, this is a very dangerous parasite to be infected with. It causes primary amoebic meningoencephalitis. So make sure you know what that acronym stands for. It is associated with swimming or diving into fresh or brackish water. So the warm, fresh, or slightly salty water of lake streams, hot springs, and even swimming pools. You often hear about Naegleria fowleri in the summer when people are out swimming. And it unfortunately is a lot of times happens with children because they're the ones usually doing the most swimming outdoors. It is devastatingly, rapidly fatal. So what happens is the patient has been swimming in the contaminated water, and the parasite enters through the nasal cavity, so it's inhaled. And this is very easily done when you're swimming or you're diving in and that water is rushed up your nose, forced up your nose. And the parasite then invades the CNS. So its point of entry is the nasal passage, and then of course the CNS is very close to that, so it gains entry into the CNS. With PAM, there is rapid tissue destruction, and if the patient is left untreated, they are probably going to die within 3 to 6 days. They can survive if signs are recognized early, but if not, it almost always results in death. What's unfortunate is that the symptoms start out pretty vague, so you're not running to the emergency room when you have just a fever or a headache or maybe some drowsiness, but maybe day 2 you start nausea and vomiting, and still moms aren't bringing their kids and dads aren't bringing their kids to the doctor for these nondescript symptoms. But then, maybe even 12 hours later, a stiff neck might set in, seizures might start occurring, confusion, smell and taste alterations. This is probably when the parents are bringing children to the doctor to the emergency room, but this might be too late to start treatment. So these symptoms look like bacterial meningitis. So they're probably in the ER going to do a spinal tap, and of course ordering tests and getting admitted. All this takes a while, and that's why by that time it's probably too late to start treatment, unfortunately. The life cycle of Naegleria fowleri is interesting because it is categorized as an amoeba, so it's got the troph form that has pseudopods for its means of motility, but it also has a flagellate form. So in addition to existing as a troph and a cyst, like the other amoebas we've talked about, it can also exist as a flagellate form when it needs to go look for nutrients, when it needs to be more mobile than just the troph. So it is categorized, or it's called an amoeboflagellate. However, we're not putting it into the flagellate lecture. It's an amoeba first and foremost, but it also has a flagellate form. So the diagnosis is finding the trophozoite form in the CSF. The cyst and the flagellate form are not found in humans, so we would not see that in the sample. And unfortunately, this is often diagnosed at an autopsy or after the fact. So hopefully in your lifetime you'll never see this in a sample. The motility is described as directional with the blunt pseudopodia, and you do have some nuclear characteristics here. However, and this is what it looks like. I will never just show you this picture without any additional information because there's nothing really remarkable here to set it apart from the other amoebas. And like I said, it would be very rare for you to actually see this, to diagnose this. So if I showed you this picture, you'd have a little bit more information. Like this is a CSF sample, the patient exhibited the following symptoms, so you wouldn't just get a picture like this and have to identify it without any additional information. So then we have acanthamoeba. There are several species of acanthamoeba that are clinically significant, but we're just referring to all of them as a group and just referring to the Acanthamoeba genus. Acanthamoeba causes GAE, which is granulomatous amoebic encephalitis. So keep Naegleria and Acanthamoeba separate. Naegleria causes PAM and acanthamoeba causes GAE, but both of them have a CNS involvement. Whereas Naegleria can infect anyone, any healthy individual. You don't have to be immunosuppressed to contract PAM, and that's also why it's so devastating. You have normal, healthy children playing in water, and then it's so rapidly fatal. For acanthamoeba, it's more of an opportunistic infection. Usually the immunosuppressed patients are contracting GAE, but there is CNS involvement. So getting infected by the getting infected by the cyst, the organism does spread to the CNS via the bloodstream, and it can have manifestations elsewhere in the body, but the most common is the encephalitis. Symptoms are more or less the same with any CNS involvement, but these symptoms progress very slowly. This is a very slow developing disease. It's not the quick onset, not by a long shot like Naegleria is. This might take months or years. Also, with AIDS patients, especially, they've noticed non-healing lesions on extremities and face, so there's a cutaneous manifestation as well. In addition to causing GAE, the Acanthamoeba genus also causes amoebic keratitis. So know both of these disorders associated with Acanthamoeba. This is most commonly seen in contact lens wearers who use homemade non-sterile saline. But it can occur in anyone who's experienced corneal trauma. Symptoms are photophobia, blurred vision, inflammation, and severe pain. We would want a corneal scraping for diagnosis of amoebic keratitis to see the organism in that, make a wet prep of the corneal scraping and be able to see it. Now, despite treatment, and treatment does work, does help, but despite treatment, you could still lose vision in that eye. So this is pretty serious, and contact lens wearers, especially the hard contact lens wearers, especially the soft ones, these people need to be acutely aware of the dangers of using homemade non-sterile saline. So like I said, it's not acute, it's chronic, developing over time, and this is referring to GAE, sorry. So we're back to GAE, is a chronic condition, usually diagnosed at autopsy, and you would be identifying cysts or trophs in the CSF. So again, just like Naegleria, The ideal choice, specimen choice is CSF. Same thing here for GAE. Okay, just like Naegleria, I'm not going to show you a picture like this without any additional information. So it otherwise looks like there's nothing remarkable standing out here, compared to the other amoebas. So I would be telling you symptoms or some other clues to help guide you to lead you to acanthamoeba. I do want to mention it got its name because it the troph has special pseudopods called acanthopodia, which means that they're spine-like or thorny. And you can't see that in this picture, but that's how it got its name, where the pseudopods aren't nice and wide, round. They're very pointy.